Good afternoon, everybody. Welcome to eVox Neuroscience Lunch and Learn on today, June 27th. My name is Morgan Edmondson. I'm the Medical Affairs Manager here at eVox. And before I get too far ahead of myself, I just want to make sure everybody can hear me loud and clear. So in your little GoToWebinar menu, there's a question bar. And in that question bar, if you can type in, yep, I can hear you, or tell me what the weather is like where you are, or even where you are. For me, it's a good morning. It's 9 a.m. here in California, but I know that a lot of you are on the East Coast. Awesome. Looks like we have people that can hear me. So today we're going to be talking about therapeutic interventions with neurofeedback. So for those of you that have used neurofeedback with the eVox system before, this might be kind of a review and perhaps give you a little more insight onto the scientific backing of why neurofeedback works for different types of patients. And for those of you who have never used neurofeedback for eVox or with eVox, this will be a great introduction and give you some ideas on how to create treatment protocols for patients that stand to really gain a lot from this type of treatment. Now, I am no neurofeedback expert, but fortunately, eVox has a board-certified biofeedback person on staff, and that is Andrew Sather. He's our training and education manager. And when you are being onboarded with eVox, you might have done some training with him. So if you know Andrew, that's great. And if you don't, now you do. He's a great resource for all things biofeedback and neurofeedback, and he's going to be presenting our Lunch and Learn presentation today. So Andrew, you can take it away. And for those in the audience, note that if you have questions for Andrew, submit it in that question box you just told me you could listen to or hear me in. And Andrew can address those questions if we have time. And if not, he can get back to you via email after the presentation.
All right,
so
excellent.
Andrew.
Thank you, Morgan. Terrific. So welcome, everybody. Happy to be here with you today. And hopefully we'll share and learn a lot of good information about neurofeedback. And as you know, the eVox system is certainly a biofeedback device. And if training is necessary for staff on how to utilize that software, I am more than happy to set that up with you. Now, as we go forward here, we're going to cover a lot of material. And hopefully, we're going to really work on reviewing neurofeedback as a tool for intervention with different brain-based disorders. And this webinar will really improve your basic knowledge of neurofeedback and its application in your practice. Again, more specific training can be done separately. And at the end of this presentation, you all should be better able to, one, understand what it is and how it works, have the ability to review some of the key research on neurofeedback and what patient types it can be used for, implement a basic outline for a neurofeedback program, and also describe the basic components of a training session. So we're going to cover all of these things as we go through our Lunch and Learn today. First, let's start with the definition, though. As a very general overview, biofeedback is defined as a computerized technique that helps improve overall health by exercising different physiological processes. Processes that we typically think of as involuntary, things like heart rate and brain activity. But today we're going to specifically discuss EEG biofeedback or neurofeedback. And in simplistic terms, neurofeedback exercises and strengthens the brain. It calms it, and it also improves overall stability and state flexibility. It's easy to do. Anyone can do it. Children, teens, adults can all benefit from training with neurofeedback. Now, some of the key features that make neurofeedback attractive are, one, the fact that it's non-invasive, it is painless, and it's medication-free. In my personal experience over the last 15 years of doing biofeedback, there's really been a big shift in how people are looking to improve their health towards interventions like neurofeedback. And with that in mind, it has been used for many decades, and it is certainly backed by extensive research. And we will take a look a little bit more closely at that research going forward here. Finally, the results are permanent. Occasionally, people might require or even seek out booster sessions, or what I also call maintenance sessions, but overall, the results are learned. There are a few organizations that do offer extensive research information, even advanced education, and of course, board certification for biofeedback. And you can see those noted here: ISNR, AAPB, and BCIA. I certainly encourage you to seek out these different organizations or groups. And again, I'm always happy to help guide you as you go through your biofeedback experience. Let's take a look under the hood, so to speak, here at how does neurofeedback work? What is the process? And as an experience, neurofeedback is inactive. It's really a subconscious process that works through operant conditioning principles. Patients are typically unaware even of the changes that the brain is making, as these changes cannot be forced. Simply allowing the brain to learn using computerized feedback allows for healthier brain patterns to develop. And when the brain performs in a healthy pattern, reinforcement is provided by the computer in the form of visual feedback. For example, learning is indicated by a green light. The simplicity of this type of feedback of a single green light is actually most effective. It does provide the brain with an immediate connection to the training and to the feedback process. Now, the training is customized to help the brain learn to increase or decrease activity in specific brain waves. So for each different patient, you can customize a very specific training protocol. Now, when performance during a training session falls outside of the parameters that are set, that green light turns off. And the idea is with repetition, these newer, healthier brain patterns become learned. Now let's take a look at a simple visual of that feedback loop, okay? We have the EEG cap sensors, which record the brain data in real time. The computer measures the power of this activity and provides feedback to the patient. There you can see the green light. This feedback in turn reinforces new connections in the brain and allows for the permanency to settle in. Let's look at key research, starting with cognitive decline. Overall, research and literature over the years has suggested that neurofeedback can be a big part of any program for a variety of disorders. And specifically in the area of cognitive health or cognitive decline, neurofeedback has been shown to effectively harness neuroplasticity, improving function in an aging brain. However, it should be noted that without objective biomarkers, it can be quite difficult to identify cognitive decline unless there are notable memory loss symptoms present. So using biomarkers from the eVox assessment, early cognitive decline can be more easily identified. This allows neurofeedback interventions to be used as a preventative, which can be highly effective. To highlight one of these noted research articles that are at the bottom of the screen here, we can see that the results of a Wechsler memory scale score from a pre, a post, and follow-up tests all show that there were significant and lasting improvements. In particular, this research looked at training the inhibition of slow EEG waves, particularly 2 to 8 hertz. As we know, slow EEG waves like delta and theta are typically noted in high power for memory loss patients. So training the brain to inhibit or decrease these slow EEG waves can improve cognitive health. Let's take a look at a few others. We look at affect issues, disorders such as depression, anxiety. Neurofeedback has been shown to be highly effective for these issues as well. And here we can even highlight a figure from Hammond's research that illustrates MMPI changes from pre to post neurofeedback training, specifically for a depressed patient. You can clearly see not only is it the depression scale that is notably improved, but many of the other scales as well have shown improvement. And that is part of the beauty of neurofeedback, is training does not only specify positive results in one particular area. There's always a a wider range or a ripple effect on cognitive health and functioning, despite what type of training you might be doing. Looking at brain injury, these types of patients can also greatly benefit from neurofeedback. There are many research articles for head injury. Certainly over the last decade or so, with increased social awareness, in particular about concussions, and the availability of more sensitive metrics like those provided by the eVox system. This is a big area for current use. You can see a chart here that summarizes a small portion of the research results on head injury and neurofeedback. There have been several textbooks written on it as well. And if this is an area of particular interest to you, we are more than happy to share some of that additional information. ADHD is one of the most well-researched areas for neurofeedback use. There's a substantial white paper actually available to you. This comes from the Journal of Neurotherapy, and it gives a very thorough review of neurofeedback and its effects on ADHD. And it's quite overwhelming in how positive neurofeedback can be for folks with attention issues. In this particular highlighted study here, we can see significant improvement was noted in the TOVA when participants were tested while using Ritalin and with neurofeedback. We can certainly see that they improved with both cases, but following a 1-week discontinuation of Ritalin, all right, the bottom portion where it says without Ritalin, participants from the two groups were again reevaluated with the TOVA. And only those that had received the EEG biofeedback sustained these gains. Additionally, the results of a QEEG revealed significant reduction in slow EEG activity only in the patients who had received the EEG biofeedback. Again, speaking towards its permanency as a result and its ability to really change behavior or the source of a problem. For pain and headache patients, neurofeedback can also be a highly effective intervention. You can see from this highlighted research table that there was a significant reduction in the perception of pain and the overall pain experience for a variety of participants. I'd like to next take a look at some of the basic principles of a neurofeedback program and the individual training sessions. Think of neurofeedback training as a treatment dose. Similar to a medication prescription, neurofeedback training is based on duration, frequency, and intensity. Same as how a physician would manage the use of a medication for a patient. How much should they take? When should they take it? And how often? Okay, let's start with frequency. Ideally, 3 sessions per week is best. I know typically that can be difficult to get patients into the office 3 days per week, but at a minimum, 1 to 2 sessions a week is effective. The most important aspect for optimal results, similar to going to the gym, is consistency. Having your patients come in on a regular basis is what will build up the behavioral changes and allow the brain to learn. If there's a very inconsistent attendance for neurofeedback, it might not be a good fit for a patient. Daily training, I want to make a quick note about. It's something that is not done too often, but it is certainly something that you may come across. It is an intensive but doable format for training. It does typically result in more fatigue than usual, and it certainly requires a commitment by the patient, not only for attendance, but also to take care of themselves in between sessions, eating properly, getting proper rest, ensuring that their brain is well rested for the next day's training. Duration is a setting within the neurofeedback program. It's something that changes over time, and it reflects the amount of training time that a patient actually does during a neurofeedback session. And a typical session is broken down into shorter training runs. This outline that you see on the screen is a general guide, not a specific training plan. Typically, the idea is to start with short 2-minute, for example, training runs and slowly building up over time. Initially, you may only train for 20 minutes total. Again, there is a fatigue factor that is a part of neurofeedback, but as stamina builds up, you can have your patients doing more and more training, and ultimately up to 30 or even 40 minutes total, with longer runs built in as they progress through the program. Intensity, or how difficult is the training? We talked about receiving feedback from the computer. Well, how difficult is it for the brain to achieve that feedback? How challenging is it? And this intensity can refer to a reinforcement rate for the patient's optimal learning. So it reflects, again, that challenge or how difficult it is to achieve the green light. And in general, you want to typically keep this around 75 to 85% reinforcement as a general idea. And what's nice about the eVox Advanced Neurofeedback program is that it does provide an easy to use threshold tool to manage this difficulty called the in-zone percentage, allowing therapists and technicians to identify how successful a patient is at keeping that green light on will allow them to manage the difficulty level appropriately. The idea over time is to make the difficulty level higher, make it more challenging for the brain to turn that green light on. A common question for anybody, whether they're experienced or new to neurofeedback, is, well, how many sessions do I need to do with my patient? And it's a question that you can typically ask yourself. Well, what does this patient require? And in general, the number of sessions can differ. And a follow-up assessment will ultimately help determine the need for additional training. But this is a good estimate of what to expect based on different patient types. Some patients may require more training depending on symptom severity and clinical profile. For example, you might have a patient with some anxiety features, fatigue, maybe some difficulty with focus or attention. And this might be someone that needs closer to 40 or 50 sessions total. But in this case, a repeat assessment after 25 sessions will really allow you to assess progress, right? Compare it to their baseline and modify the training as needed for an additional 25 sessions. I'd like to share a couple of my personal cases that I've worked on that had some nice outcomes and hopefully share with you the perspective of designing a training protocol and what to look for within a patient's data set that might help explain that neurofeedback will help and be a positive experience. In this first case, okay, we have a patient that is a 48-year-old male, and he is reporting symptoms, as you can see here, in memory, attention, and motor functions. His behavioral metrics also note slowed reaction time and some difficulty with sustained attention. You can see his reaction time variance is quite high. Okay, so trouble staying on task for him, particularly at work. Even in the ERP measures, we can see a reflection of some of this memory and attention issue as noted by the low power in his P3B. This really shows me that that there's a lack of neuronal activity in information processing functions. Finally, his brain maps show a clear global power deficit. You can see there's a lot of low power or blue colors in both slow frequencies and fast frequencies. This is certainly supportive of an overall fatigue or low energy profile, essentially hypofunction in the brain. But if we look really specifically and we look closely here at the beta frequency, we see a real significant power deficit. And again, this is a brain that is sluggish, impacting memory and attention functions, just lacking the energy to get going. And this is certainly, this low power beta feature is certainly something that can be trained using neurofeedback. So in conclusion, what do we have? A patient with mild cognitive impairment. He is almost 50 years old. We can see the low power in his P3B. We see some reaction time variance and motor speed deficits, okay? So this is a clear case for neurofeedback. Now the next question is, well, what do we train? What is the protocol for this gentleman? And you can probably design a few different protocols, but most effectively, what we're looking at here is 13 to 20 hertz as a reward frequency. So we want to increase beta, okay? The neurofeedback will aim at improving the activity in beta frequency, raising his level of functioning, his neuronal activity, and hopefully alleviating his symptoms. Training will be carried out at frontal sites at F3 and FZ. There is certainly a ripple effect on the brain with training. So there's not always a specific one or two spots that are the correct, so to speak, areas for training. Again, we're training frontally here as we see a lot of the beta weighted in terms of significance for deficits towards the frontal lobe. This will hopefully address some of his attention deficits as well and difficulty with cognitive processing speeds. For a training dose, all right, if we want to consider that, frequency was twice a week and we recommended 25 training sessions. Now, another thing to note here as well is he was also referred for a sleep study. If you look at his theta frequency range, about 4 to 8 hertz, you can see there's very low power in the theta frequency. And oftentimes this can be correlated to sleep issues. Could be insomnia or maybe a sleep apnea difficulty. So he was referred out for a sleep study as well. Now, following 25 sessions of neurofeedback, we can take a look at some of the progress that he made. Again, we see his baseline here for his self-report, okay? We see the deficits in memory, attention, and motor. And then the follow-up assessment, we can see he's clearly reporting improved functioning. Similarly, the behavioral metrics also illustrated a significant change. Reaction time was improved. His reaction time variance was significantly improved. Right? He was better able to stay on task and focus. The ERP data, particularly for the P3B, also noted a significant improvement in power. Okay, so that part of his brain, even though we weren't training it directly in the parietal lobe, still showed a significant improvement. And those are the types of things that you can expect from neurofeedback, is to change multiple regions of the brain as one region improves. Now, finally, let's take a look at his head maps, where we see his baseline on the left-hand side. And what you'll notice in the follow-up assessment, okay, is an improved efficiency and flexibility noted by normalized beta activity. So you can see there was a significant improvement or normalization in his beta activity. It's more green, it's less dark blue, all right? Now, I'd like to also take a moment here to provide a little bit of training and education, since that's my role at eVox, can't help myself, on a feature that we see in this particular follow-up mapping. Some of you may have noted that there is what appears to be an excess of beta in the left prefrontal lobe, FP1. And you can note that in 21 through 30 hertz in particular, even starting as early as 19 or 18 hertz. But that feature, when I see something like that, notably localized to a particular sensor, I want to rule out muscle tension. When we suspect muscle tension, we have to understand that the normative database comparison does not identify muscle tension as muscle tension. It identifies it as excess beta activity. And by looking at the raw EEG for this particular client, we found that in the FP1 sensor, there's notably darker and faster EEG when you can look at it compared to the other EEG channels, which confirms muscle tension being picked up in that sensor. So essentially that FP1 excess beta activity is unreliable, and you can't really consider it a clinical finding. Let's take a look at another case. This is a 50-year-old male. He was reporting symptoms in multiple domains of functioning, including attention, affect, sensory, motor function. And he was having difficulty staying on task and focusing at work. He also reported issues with perseveration, felt like he was getting stuck, unable to let go, so to speak. His behavioral metrics illustrate some slight deficits as well here, with processing speed and focus. For ERP measures, both the P3A and the P3B note a delayed response speed, okay? You can see they're both outside of normal. And his brain map illustrated a very clear high power feature or high power beta feature, particularly in the frontal lobe. Looking at the brain maps and considering some of his self-report as well, we certainly can conclude that this is a patient that has some obsessive behaviors, compulsive behaviors, again, getting stuck, and certainly correlates with some attentional difficulties from such a busy brain. Now, again, this is a great case for neurofeedback. We can see a clear deficit here, again, particularly in the frontal lobe. And let's take a look at what type of training protocol we want to utilize. For this protocol, the main idea would be to inhibit, okay, or decrease fast beta activity, 22 to about 25 hertz, okay. I would specifically targeted this patient in the frontal and central regions at FZ and CZ, okay. And he was seen twice a week for a total of about 30 sessions, okay. Again, following those 30 sessions, we remapped his brain and redid the eVox assessment, and we came away with some clear improvements. Again, self-report, we see notable improvements in all areas, okay. He's reporting better functioning at work, better functioning at home. His behavioral metrics certainly improved. He was a little quicker, a little better with processing speed and reaction time. His omission errors dropped significantly, okay, better focus, better attention, okay. And we see clearly in his P300A and B, his latency improved significantly, okay. So we saw some positive results there as well. Within the brain map itself, we saw his brain really quiet down, you know, feeling calmer and quieter. While he didn't repeat, which is interesting here, he didn't report issues with sleep at the time of his initial assessment. He certainly started to note that his sleep had improved. Getting into a deeper, more restorative sleep was noticeable as his brain quieted down. We can see that frontal beta is greatly normalized here. I'd like to take a minute and go through a quick knowledge check now, and just review some of the things that we covered here. And first thing I want to really explore are what types of patients can benefit from neurofeedback. Based on research, based on some clinical support, certainly. This field has been around for a long time. There's a lot of folks you can talk to. I'm more than happy to always share my personal experience. But we know that a variety of patients can improve with neurofeedback. You certainly can see memory loss, affect or mood, head injuries, ADHD, chronic pain or headache patients, to name a few, all improve with neurofeedback. I'd like to also see and check in on, well, what do we need to train in the brain? And this certainly comes with experience. And as I noted earlier, there's not always a perfect one training protocol to utilize. And you certainly can choose from multiple profiles in most cases. But taking a look at this particular case, let's just think about what would we train if we were looking at this particular patient. Let's think about what type of protocol we would require or recommend for this patient. Well, if we're looking at these maps, I think most significantly what you'll notice is a deficit at low alpha, particularly around 8 and 9 hertz. So this would result in a reward training program, right? Increasing 8 to 9 hertz, particularly at FZ in the frontal lobe. You can see how it's most significant in that darker circle towards the frontal lobe. As for dose or training, what is the ideal situation for your patients? Again, twice per week would be ideal. 3 times a week if you could, but twice a week would be terrific. And for someone like this, where we see about 2.5 standard deviations from normal in that low alpha, I would suspect that about 20 sessions would suffice in improving that deficit. And after that 20 sessions, I'm going to be looking to do another assessment and really seeing objectively how much progress has been made. Let's summarize our webinar today. Neurofeedback is an efficacious and non-invasive intervention to help retrain EEG activity that relates to various symptom presentations and patient types. We looked at several different research articles today, but you can certainly get a more comprehensive neurofeedback bibliography for not only the patient types that we reviewed today, but also many other patient types, including addiction, PTSD, sleep, OCD, epilepsy, autism, peak performance, as well as other medical conditions such as tinnitus or Lyme's, and Parkinson's, and even restless leg syndrome, amongst many others. A quick review of the key pillars of a neurofeedback program include duration, or how long a training session should last, frequency of training, how often should you ask your patients to be coming in. Again, 1 to 3 times a week is necessary. 2 or 3 would be ideal. And how challenging should the training be? Right? Having a therapist or technician properly manage the neurofeedback session is important and can be achieved through training. Finally, I encourage everyone, if this is your first webinar, to go back and watch some of our past webinars, some of the other clinical content that we offer, and please feel free to contact us with any training needs. All right, thank you, and I look forward to speaking to you all soon.